Hello and welcome to clinical psychology, an increasingly expansive field of psychology. So expansive and indeed popular to the point that in 2017, Kramer noted that clinical psychology is the largest subfield of psychology. Now, throughout the semester, you will learn quite a bit about this field: history, current controversies, interviewing and psychological assessment method, and, well, God willing, even psychotherapy approaches. But before we talk about all those things, we first need to look into the basics. In this video, we will first define what clinical psychology is and then outline the requirements for becoming a clinical psychologist in the Philippines and discuss the profession's popularity. Now, next, we will describe how clinical psychology relates to other mental health professions, and later on, we will describe the work, activities of most clinical psychologists and the rewards of the profession. So, as the name implies, clinical psychology is a subfield of the larger discipline of psychology. Now, like all psychologists, clinical psychologists are interested in behavior and mental processes. Like some other psychologists, clinical psychologists generate research about human behavior, seek to apply the result of that research, and engage in individual assessment. Like the many members of some other professions, however, clinical psychologists provide assistance to those who need help with psychological problems. It's actually difficult to capture in a sentence or two the ever-expanding scope and shifting directions of clinical psychology. Nevertheless, we will outline the central features of the discipline as well as its many variations in this video. Now, before we look at that, let's look at how, or rather, before we look at how clinical psychology is defined today, let's take a glance at how it was first defined back in 1907. Now, enter Leitner Whitman. Now, the term clinical psychology was first used in print by Leitner Whitman in 1907. Whitman was also the first to operate a psychological clinic. Whitmer envisioned clinical psychology as a discipline with similarities to a variety of other fields, specifically medicine, education, and sociology. Now, a clinical psychologist, therefore, was a person who works uh, with others involve aspects of let's say treatment, education, and interpersonal issues. Now, at his clinic, the first clients were children with behavioral or educational problems. However, even in his early writings, Whitmer in 1907 foresaw clinical psychology as applicable to people of all ages and with a variety of presenting problems. Now, let's look at how the APA now define clinical psychology. If you think about it, defining clinical psychology is a greater challenge today than it was in Whitmer's time. Now, the field has witnessed such tremendous growth in a wide variety of directions that most simple, concise definition fall short of capturing the field in its entirety. As a group, contemporary psychologists do many different things with many different goals for many different persons. However, the definition of clinical psychology adapted by the American Psychological Association um, Division of Clinical Psychology reads as follows. Clinical psychology is the psychological specialty that provides continuing and comprehensive mental and behavioral care for individuals and families, consultations to agencies and communities, training, education, and supervision, and research-based practices. It is a specialty in breadth, one that is broadly inclusive of severe psychopathology and marked by comprehensiveness in an integration of knowledge and skills from a broad array of discipline within and outside psychology proper. Now, the scope of clinical psychology encompasses all age, multiple diversities, and varied systems. Now, similarly, let's look at the PAP definition of uh, clinical psychology. Similarly, the Psychological Association of the Philippines define clinical psychology as the scientific study of mental health, personality, and everyday adjustment. It is the branch of psychology engaged in the diagnosis, treatment, and prevention of psychological problems. That is mental, emotional, and or behavioral problems. It is a specialty that involves the application of psychology for the purpose of understanding, preventing, and addressing psychologically based distress or dysfunction. Now, if we are to compare the two definitions that we have presented, one that is used by the by APA and the one that is used by PAP, we can see that the one used by APA is a broader definition, and the one used by PAP is a slightly more focused definition of clinical psychology. But if you are to really look at the gist of both definitions, they are actually talking about the same things. Uh, Assessment, treatment, and prevention of psychological problems using psychological concepts. Aside from the definition, let's now look at the personal requirements, personal legal educational requirements of to become a clinical psychologist in the Philippines. Now, certain requirements for those wishing to be clinical psychologists have more to do with attitudes and character than with training and credentialing. Perhaps the most notable distinguishing features of clinical psychologists have has been called the clinical attitude or the clinical approach, which is the tendency to combine knowledge from research on human behavior and mental processes with efforts at individual assessment in order to understand and help a particular person. Now, the attitude sets clinicians apart from other psychologists who search for general principles that apply to human behavioral problem in general. Clinical psychologists are interested in research of this kind, but they also want to know how general principles shape lives, problems, and treatments on an individual level. Because clinical psychology is both rigorously scientific and deeply personal, it requires that people entering the field have a strong and compassionate interest in human beings. Clinical training programs, admission committees look for a number of characteristics as they make decisions about which applicant to admit to graduate study in clinical psychology. Personality variables such as an interest in people, integrity in dealing with others, emotional stability, and intellectual curiosity are of particular importance in selecting candidates in many prestigious schools. Now, these traits are important in many jobs, but if you think about it, they are crucial in clinical psychology because clinicians regularly work in situations that can have significant and lasting personal and interpersonal consequences. Even those clinical researchers who don't themselves offer psychotherapy may still make decisions about matters of personal consequences to participants. So, integrity, emotional stability, and sound judgment are required for both of them. Now, before we look into the legal, educational, and ethical requirements to be a clinical psychologist in the Philippines, let's first look at the competencies of clinical psychology in the Philippines or in the country. So, as per the PAP certification of psychology specialists primer, through their practice, clinical psychologists are qualified to undertake the following functions. Number one is to assess individuals towards diagnosis, or rather towards diagnosing the nature and cause of mental, emotional, and or behavioral problems, and understanding how these psychological problems manifest in the current level of functioning using various clinical tools such as, but is not limited to, interviewing, observation, and psychological evaluation. Uh, Number two is to conduct therapeutic interventions directed at identifying the emotional conflicts, personality disturbances, and skills deficits underlying a person's distress or dysfunction, and facilitate the healing process too, using various theoretical orientations, modalities, and techniques relevant and appropriate to the needs of the person. Number three is to supervise or train students in practicum or internship program and novice practitioners training and actual work supervision programs in their conduct of assessment and psychotherapeutic interventions. And number four is to provide consultancy services in different setting, that is hospital, schools, non-government organizations, communities, mental health facilities that require clinical psychological services. Lastly, they are to conduct research in the area of clinical psychology to help improve and enrich current practice of clinical psychology in the Philippines. So these are the competencies, which are things that clinical psychologists in the Philippines can and should be doing as part of their responsibilities. So let's now head on over to the legal, educational, and ethical requirements to be a clinical psychologist in the Philippines. So applicants of certification as clinical psychologists must actually comply with all of these requirements. Number one is that they should be active associates or fellow of the Psychological Association of the Philippines. Number two is their educational requirements. That is, they should be at least a Master's of Arts in Psychology, or they should have at least finish the program of Master of Arts in Psychology with major or specialization in counseling, clinical psychology, family life, and child development, obtained from an accredited graduate program in psychology. Along with this, they should have taken the following graduate level courses of or the equivalent, like abnormal psychology or psychopathology, introduction to psychotherapy, group therapy, projective test, intelligence and individual testing. Number three is that they should have clinical work experience. That is at least 100 hours of supervised practicum, internship, or training related to any of the previously mentioned competencies, such as in psychological assessment, that is administering, scoring, or interpretation of psychological tests, or writing up clinical reports, in psychotherapy, and in research. As part of their clinical work experience, for those with PhD, at least 3 years minimum, that is minimum of 20 hours per week. And for those with masters, at least 5 years minimum of 20 hours per week of work in a clinical setting, like doing psychological assessment, psychotherapy, consultancy, and or research in clinical psychology. Now, evidence for such work should be documented in the form of either a psychological report, therapy notes, or report and materials of consultancy projects, and other outputs that fall within the various sub-areas of clinical psychology. Now, the evidence should show consistent work over at least 3 year and 5 year period for PhD and MA degree holders, respectively. So, number five is that they must have attended within the past 3 years prior to the date of application conferences, seminars, and continuing professional education workshop in psychology organized by agencies recognized by the PAP. Lastly, they should have not been convicted of any civil, criminal, or administrative offense, or of ethical violation related to the professional practice of psychology. Now, it's important to note that while in the primer, it was not explicitly stated that one needs to be a licensed psychologist to be a certified clinical psychologist. As per Dr. Lolina Bahin, a certified clinical psychologist and a board member of the PAP, having the license is an important requirement as it is needed if you are doing psychological practice as specified under the law. It's also important to understand that the licensure only covers psychologists doing psychological testing and providing counseling and or clinical services. The license is issued by the Professional Regulatory Commission or the PRC after the successful completion of an examination. Although not required by the law, the certification is a special recognition of one's specialized expertise in clinical psychology, given by the Psychological Association of the Philippines as a means to promote continuous development and monitor professional and ethical practices of psychologists. Now that we have identified the requirements, both personal, legal, and educational, to be a clinical psychologist in the Philippines, let's now look at what are the professional activities and employment settings of clinical psychologists in the Philippines. Now, let's consider in more detail some of the activities that clinical psychologists pursue, the variety of places in which they are employed, the array of clients and problems on which they focus their attention, and the rewards of the job. Not all clinicians are equally involved with all the activities with we will be describing later on. But our review should provide a better understanding of the wide range of options open to those who enter the field. It might also be helpful to explain why the field remains attractive to so many students. So, about uh, about 95% of uh, clinical psychologists spend their working lives engaged in some combination of six activities, as we are seeing right here. That includes assessment, treatment, research, teaching, which includes supervision, consultancy, and administration. This figure here shows the result of a survey or surveys taken over the last decade, uh, examining how clinical psychologists spend their time. Keep in mind that the percentages vary considerably across work settings. Psychologists, for example, in university setting, will spend more time engaged in teaching and research, and those in private practice will spend more time conducting psychotherapy and assessment. So let's look at each of these uh, responsibilities and work experiences that clinical psychologists perform. Starting with assessment. So, assessment involves collecting information about people, their behavior, problems, unique characteristics, abilities, and intellectual functioning. So the information may be used to diagnose problematic behavior, to guide the client towards an optimal vocational choice, to facilitate selection of job candidates, to describe a client's personality characteristics, to select treatment techniques, to guide legal decisions regarding the commitment of individuals to institution, or to provide a more complete picture of a client's problem to screen potential participants in psychological research projects. They are also used to establish pre-treatment baseline levels of behaviors against which to measure post-treatment improvements, and for literally hundreds of other purposes. Most clinical assessment instruments fall into one or three categories: test, interviews, and observations. So, clinicians today have an array of assessment options not formerly available to them. For instance, computers can administer assessment items, analyze results, and generate entire written reports. Another frontier of psychological assessment is developing from research on a variety of biological factors associated with human functioning. Now, during the last 2 decades, research focusing on genetic, neurochemical, hormonal, and neurological factors in the brain has led to the development of new neurobiological assessments. So these changes too have the potential to greatly enhance the assessment efforts of clinicians, but as with computer-based assessment, they raise a number of procedural, practical, and ethical questions. So the second responsibility that clinical psychologists perform is on treatment. Now, clinical psychologists offer treatment designed to help people better understand and solve distressing psychological problems. These interventions are known as psychotherapy, behavior modification, psychological counseling, or other terms, depending on the theoretical orientation of the clinician. Treatment sessions may include client or therapist monologues, painstaking construction of new behavioral skills, episodes of intense emotional drama, or many other activities that range from highly structured to the utterly spontaneous. Now, individual psychotherapy has long been the single most frequent activity of clinicians. But psychologists may also treat two or more clients together in couple, family, or group therapy. Sometimes, two or more clinicians work in therapy teams to help their clients. Treatment may be as brief as one session or may extend over several years. Some psychologists, known as community psychologists, focus on preventing psychological problems by altering the institutions, environmental stressors, or behavioral skills of people at risk of disorders, which includes teenage parents or of an entire community. So the results of psychological treatments are usually positive, though in some cases the change may be small, non-existent, or even negative. So, of course, increasing the effectiveness of treatment offered to the public is a key goal of research. The third activity or the third responsibility that clinical psychologists perform is on research. Now, by training and by tradition, clinical psychologists are research oriented. For most of the first half of its existence, the field was strongly dominated by research rather than by application. Although the balance has changed, research continues to play a vital role on clinical psychology. Research activity makes clinicians stand out among other helping professions. And we believe it's in this area that they may make their greatest contribution. In the realm of psychotherapy, for example, theory and practice were once based mainly on case study evidences, subjective impressions of treatment efficacy, and rather poorly designed research. This pre-scientific era in the history of psychotherapy research has evolved into an experimental era in which the quality of research has improved greatly, and the conclusions we can draw about the effects of psychotherapy are much stronger. So this development is due in large measure to the research of clinical psychologists. Now, clinical research varies greatly with respect to its setting and scope. Some studies are conducted in research laboratories, while others are conducted in the more natural but less controllable conditions outside of the laboratories. So some projects are supported by governments or private grants and that pay for research assistance, computers, and other costs. But a great deal of clinical research is performed by investigators whose budgets are limited and who depend on volunteers help, and their own ability to obtain space, equipment, and participants. Now, clinical psychologists' tradition on research is reflected in graduate school admission criteria, which often emphasizes clinical or applicants grade in statistics or research method over grades in abnormal psychology or personality theory. Many graduate departments in psychology regard research experience as among the three most important criteria for admission. And graduates of research-oriented clinical psychology program typically outperform graduates of programs that don't emphasize research as much. Now, there are at least four reasons. First, it is important that all clinicians be able to critically evaluate published research so that they can determine which assessment procedures and therapeutic interventions are likely to be effective. Second, clinicians who work in academia must often supervise and evaluate research projects conducted by their students. Third, when psychologists who work in community mental health centers or other service agencies are asked to assist administrators in evaluating the effectiveness of the agency's program, their research training can be very valuable. Finally, research training can help clinicians objectively evaluate the effectiveness of their own clinical work. Tracking client changes can signal the need to change treatment plans, reveal the need for additional clinical training, and contribute to third party, that is, insurance companies, clinical researchers, efforts to document and understand factors affecting clinical effectiveness. So now, a considerable portion of many clinical psychologists in the Philippines spend their time in educational activities. Clinicians who hold full or part-time academic positions typically teach undergraduate and graduate courses in areas such as personality, abnormal psychology, introductory clinical psychology, uh, psychotherapy, behavior modification, interviewing, psychological testing, research design, and clinical assessment. They conduct specialized graduate seminars on advanced topics, and they supervise the work of graduate schools who are learning assessment and therapy skills in practicum courses. Now, a good deal of clinical psychologists' teaching take the form of research supervision. This kind of teaching begins with when their students and professors discuss research topics of mutual interest that are within the professor's area of expertise. Most research supervision help the students frame appropriate research questions, apply basic principles of research design to address those questions, and introduce the students to the research skills relevant to their problem at hand. Now, clinical psychologists also do a lot of teaching in the context of in-service, that is on-the-job training of psychological, medical, or other interns, social workers, nurses, institutional aides, police officers, prison guards, teachers, administrators, business executives, daycare workers, lawyers, probation officers, and many other groups whose vocational skills might be enhanced by increased psychological sophistication. So, clinicians even teach while doing therapy, particularly if they adopt a behavioral approach in which treatment includes helping people learn more adaptive ways of behaving. Uh, Finally, many full-time clinicians teach part-time in colleges, universities, and professional schools. Working as an adjunct professor provides another source of income, but clinicians often teach because it offers an enjoyable way to share their professional expertise and to remain abreast with new development in their field. Now, clinical psychologists often provide advice to organizations about a variety of problems. This activity, known as consultation, combines aspects of research, assessment, treatment, and teaching. Perhaps this combination of activities is why some clinicians find consultation satisfying and lucrative enough that they engage in it full time. Organizations that benefit from consultants' expertise range in size and scope, from one-person medical or law practices to huge government agencies and multinational corporations. Now, the consultants may also work with or with neighborhood associations, walk-in treatment centers, and many other community-based organizations. Consultants perform many kinds of tasks, including education, that is familiarizing staff with research relevant to their work, advising, that is about cases or programs, direct services like assessment, treatment, and evaluation, and reduction of inter-organizational conflict, which includes eliminating source of trouble by altering personal assignments. Now, when consulting is uh, case-oriented, the clinician focuses attention on a particular client or organizational problem and either deal with it directly or offer advices on how it might best be handled. When consultation is program or administration oriented, the clinician focuses on their aspects of organizational functions or structures that are causing trouble. For example, the consultant may suggest and develop new procedures for screening candidates, various jobs within an organization, set up criteria for identifying promotable personnel, or reduce staff turnover rates by increasing administration's awareness of the psychological impact of their decisions on employees. Lastly, uh, many clinical psychologists find themselves engaged in managing or running the daily operations of organizations. So, example of of the administrative post held by clinical psychologists include head of a college or university, uh, psychology departments, director of a graduate training program in clinical psychology, director of a student counseling center, or head of a consulting firm or testing center, superintendent of a school system, or chief psychologist in a hospital or clinic. So the thing is, administrative duties tend to become more common as clinicians move through their professional careers. Although some clinical psychologists spend their time at only one or two of the six activities we have described, most engage in more and some perform all six. To many clinicians, the potential for distributing their time among several functions is one of the most attractive aspects of the field. Lastly, let's talk about how clinical psychology is related to other mental health professions. So, let's look at how clinical psychologists differ from counseling psychologists, psychiatrists, social workers, and school psychologists. So, there have been a time when counseling psychology and clinical psychology were quite distinct. But today, there is a significant overlap between these two professions. Historically, they have differed primarily in terms of their clients' characteristics. Clinical psychologists were more likely to work with seriously disturbed individuals, whereas counseling psychologists were more likely to work with or counsel less pathological clients. But today, many clinical and counseling psychologists see the same types of clients, sometimes as colleagues working side by side. Now, these two fields are also similar in that their graduate students occupy the same internship sites, often earn the same degree, and take the same licensure examination. In fact, the two professions share so much common ground uh, that it is entirely possible for a client who seeks the services of a psychologist with a degree on clinical psychology, or with a degree behind their name, never to know whether that person is in clinical psychology or counseling psychology. In fact, there are many certified clinical psychologists who are also certified counseling psychologists in the Philippines. Now, few meaningful differences, however, remain between the clinical and counseling psychologists. Compared with counseling psychologists, clinical psychologists still tend to work with more seriously disturbed population, and correspondingly tend to work and complete in their internship more often in settings such as hospitals and inpatient psychiatric units. And compared with clinical psychologists, counseling psychologists tend to work with less seriously disturbed populations and correspondingly tend to work and complete um, internship more often in university counseling centers. Some differences in theoretical orientation are also evident. Both fields endorsed eclectic orientation more than any other, but clinical psychologists tend to endorse behaviorism more strongly, and counseling psychologists tend to endorse humanistic and client-centered approaches more strongly. So additionally, counseling psychologists tend to be more interested in vocational testing and career counseling, whereas clinical psychologists tend to be more interested in applications of psychology in medical setting. So now let's look at the comparison between clinical psychologists and psychiatrists. Now, unlike clinical or counseling psychologists, psychiatrists go to medical schools and are licensed as physicians. In fact, their specialized training in psychiatry does not begin until well into their training. The first several years are often identical to that of other types of physicians. As physicians, they are allowed to prescribe medications. Until recently, psychologists could not prescribe medication, but a significant movement in the in or among clinical psychologists have been uh, to propose to allow them to be able to prescribe medication, but the said movement has yet to gain significant traction. So the difference between psychiatrists and clinical psychologists is more than just the ability to prescribe medication. The two professions fundamentally differ in their understanding of and approach to behavioral or emotional problems. Clinical psychologists are certainly trained to uh, appreciate the biological aspects of their clients' problems, but psychiatrists' training emphasizes biology to such an extent that disorders, depression, anxiety, uh, attention deficit hyperactive disorders, borderline personality disorders, and so on, are viewed first and foremost as physiological abnormalities of the brain. So to fix the problem, psychiatrists tend to fix the brain by prescribing medication too. This is not to imply that psychiatrists do not respect talking cures like psychotherapy or counseling, but they favor medication uh, more than they favor psychotherapy and counseling. So for clinical psychologists, the biological aspects of clients' problems may not be their defining characteristics, nor is pharmacology the first line of defense. Instead, clinical psychologists view clients' problem as behavioral, cognitive, emotional, still stemming from brain activity, of course, but amenable to change via non-pharmacological methods. So let's also look at how clinical psychologists differ from social workers. Now, traditionally, social workers have focused their work on their interaction between an individual and the component of society that may contribute to or alleviate the individual's problems. They saw many of their clients' problems as products of social ills, racism, oppressive gender roles, poverty, abuse, and so on. So they also help their clients by connecting them with social services such as welfare agencies, disability offices, or job trainings. So more than their counterparts in psychology or psychiatry, they were likely to get into the nitty-gritty of their clients' worlds by visiting their homes or workplaces, or by making contacts on their behalf with organizations that might prove beneficial. When they work together with psychologists and psychiatrists, they usually focus on issues such as arranging for clients to transition successfully to the community after leaving an inpatient unit, by making sure that needs such as those for housing, employment, and outpatient mental health services were being met. Now, in more recent years, however, the social work profession has grown to encompass a wider range of activities too. And the similarity of some social workers, especially those conducting therapies, uh, to clinical psychologists has increased. The training for social workers, however, remain quite different from the training of clinical psychologists. They are not required to have a master's degree to take their licensure exam, and although their training include a strong emphasis on supervised field work, it includes very little on research method, save for case studies, psychological testing, or physiological psychology. Their theories of psychopathology and therapy continue to emphasize social and environmental factors. Lastly, let's look at the difference between clinical psychologists and school or educational psychologists. Now, as the name implies, school or educational psychologists usually work in schools, but some may work in other settings such as daycare centers or correctional facilities. Now, their primary function is to enhance the intellectual, emotional, social, and developmental lives of students. They frequently conduct psychological testing, especially intelligence and achievement tests, to determine diagnoses such as learning disorders or ADHD. They use or develop programs designed to meet the educational and emotional needs of students. They also consult with adults involved in the students' lives, teachers, school administrators, school staff, parents, and are involved to a limited degree in direct counseling with students. Lastly, you don't need to be a licensed psychologist to be a certified expert in educational or school psychology in the Philippines. So, uh, this ends our lesson on the basics of clinical psychology. My name is Dex Kamitan, and thank you for watching.